Hi students, this is me, Dr. Aditi Tiwari once again, and today I'm back with another important topics in psychiatry, and this is about dissociative disorders. Okay, in this presentation, I'll be talking about depersonalization disorder, derealization disorder. We'll be learning about dissociative amnesia, dissociative fugue, and so on. And for USMLE examinations point of view, the questions will come especially in USMLE Step 1 and 2, and I have sent few questions regarding dissociative fugue and multiple personality disorder and few words, let's say, about depersonalization and derealization disorder. So yes, this is one of the important topics, but it is very short one, so I'll try to finish it earlier. And if you feel the speed of my presentation is slow, you can always increase the speed to according to your need in YouTube. So now let's proceed. So in dissociative personality disorder, the first thing we are going to study is depersonalization and derealization disorder. So in depersonalization disorder, persistent feelings of detachment or estrangement from one's own body, thoughts, perceptions, and actions. Okay, whereas in derealization disorder, persistent feeling of detachment or estrangement from one's own environment is there. So in depersonalization, the person will feel detachment, okay, from one's own body. So they feel like an outside observer of one's own thought and body. So they are there, but they think that they are viewing their body, their thoughts, as an outsider and not as self. So that is depersonalization. And in derealization disorder, they think that the feelings of detachment from one's own environment. So these are important topics. So in USMLE, we have to understand that in depersonalization disorder, there is intact reality testing. Okay, this is important. The patient knows the experience is not real. Okay, so the patient knows that they are experiencing some this depersonalization feelings, and they understand that this is not normal. So there is intact reality testing, and this distinguishes it from psychosis, where reality testing is impaired. Okay, so this is and the symptoms, as I said earlier, feeling like an outside observer of one's own thoughts or body, feeling like the world is unreal, dreamlike, or distant, and this is persistent. This is persistent over the period of the time, or let's say it's recurrent. Okay, and the key distinguisher is that, again, as I said earlier, reality testing is intact in depersonalization and derealization disorder, but this reality testing is not present in psychosis. And okay, this leads to significant functional impairment in person's life. Next is we are going to learn about dissociative amnesia, inability to recall important personal information, usually following severe trauma or stress. So in dissociative amnesia, the person will be gives the history of severe trauma or the stress, and the patient's party will say that he has sometimes he has an inability to recall his own personal information. Again, so core feature is that inability to recall important autobiographical information, too extensive to be explained by ordinary forgetfulness, and trigger is that usually follows severe trauma or stress, example being abuse, combat, or natural disaster. Now, along with dissociative amnesia, we have to know about dissociative fugue. Dissociative fugue means abrupt, unexpected traveling away from home. So it often accompanies dissociative amnesia, and when they go to a new place, they often assume a new identity. So this is dissociative fugue. Again, USMLE point of view, this dissociative fugue is very important in examinations. Okay, I have seen these questions appearing in USMLE examinations. So now USMLE tip is dissociative fugue is a specifier for dissociative amnesia. So, and the person will have stress or severe trauma, and then he suddenly has dissociative amnesia. He doesn't recall who he is or any autobiographical information of himself. So now he wanders and he reaches to a different place, and that is called dissociative fugue, and then he may assume a different identity. So this way dissociative amnesia and dissociative fugue sometimes comes along with. Okay, So again, dissociative fugue is a specifier of dissociative amnesia. It is not a separate diagnosis. And look for purposeful travel, memory loss in the vignette. Okay, this is important. And next topic we'll be learning about is dissociative identity disorder, and this is more common in females. Okay, and strong association with history of sexual abuse. Okay, previously we used to call it multiple personality disorder, but these days we call it DID, that is dissociative identity disorder. Okay, now core diagnostic feature is the presence of greater than 2 distinct identities or personality states, typically with distinct memories and patterns of behavior. So like in this photo, there is a person and he also have greater than 2 identities, like this identity and this identity. So he has greater than 2 distinct identities or personality states, and each of them have their own distinct memories and their own patterns of behavior. Okay, and they tend to switch from one to another, and this is most common in females, as I said earlier, and the people often have history of sexual abuse. Also with dissociative identity disorder, PTSD, somatic symptom disorder, or history of sexual abuse or childhood trauma can be elicited in some patients. Again, USMLE dissociative identity disorder was formerly called as multiple personality disorder. In vignette clue, patient has gaps in memory and other reports of different names or behaviors always associated with severe childhood trauma. Okay, now we have learned about dissociative disorder. In this video, we learned about depersonalization disorder, derealization disorder, and also dissociative amnesia, dissociative fugue, and dissociative identity disorder, right? Also called as multiple personality disorder. Now I have few questions in USMLE type of questions. You can always pause the video here and go through them. I have 3 questions for USMLE and 1 for nclex. This can be a good recap of what we just read, and I hope you'll find it interesting. Okay, in this there was something about intact reality testing. So depersonalization and derealization disorder will be there in this question. There will be more like dissociative amnesia with dissociative fugue. Okay, this sort of questions comes in examinations, and in this case it is okay, when the person shows multiple personality disorder, then the treatment modality will be long-term trauma-focused psychotherapy. There is no medications for that. Okay, when the person exhibits dissociative let's say different multiple personality disorder, so it's more like long-term trauma-focused psychotherapy is needed. And similarly in nursing, we have to choose here establish a safe trusting therapeutic relationship. I want you to go through these questions, and these are really helpful for your examinations. With this, all I do in this topic. I hope you understood this, and we'll see you in the next topic in the future. Bye bye.